Hi and welcome. This video is meant for you if you're 13 to 20 weeks pregnant. In this video, you will get information about some changes in your body that will occur during pregnancy, pelvic floor muscles, and exercise during pregnancy. The most significant changes in the body occur during the first trimester. During your whole pregnancy, weight gain will be approximately 8 to 16 kilograms. Your lumbar curvature will increase as the uterus grows. You may experience some musculoskeletal symptoms such as SI joint pain, back pain, and pubic symphysis pain. And there will be hormonal changes in the body that can cause, for example, nausea and fatigue. Our pelvic floor muscles serve as the base of our abdominal cavity, supporting and carrying the organs in the abdominal and pelvic areas, such as the bladder, uterus, vagina, and rectum. The muscles of the pelvic floor are needed in all bodily functions where abdominal pressure increases, such as coughing, straining, lifting, and exercising. Pregnancy affects the pelvic floor muscles as the body's center of gravity changes and hormonal changes take place. During pregnancy, and particularly during vaginal delivery, the pelvic floor is subjected to intense pressure and stretching. The abdominal muscles work together with pelvic floor muscles to connect the ribcage, pelvis, and back muscles into a functional unit. The abdominal and pelvic floor muscles together play a part in the force transmission, spinal posture control, reduction of spinal load, regulation of abdominal pressure, and movement production. Here you can see the deep core muscles. Multifidus are the deep muscles of the back, transversus abdominis, which is a deep muscle of abdominal area, pelvic floor muscles, and the diaphragm. The pelvic outlet is formed by the pubic symphysis, sitting bones, and the tailbone. A healthy pelvic floor is essential for the balanced functioning of the whole body. It is strong and elastic like a trampoline. Strong and elastic pelvic floor is needed for functions such as urinary and fecal continence, sexual functions, childbirth, effective breathing, and as a part of supporting the back. In this picture, you can see a woman's pelvic floor muscles viewed from below. The musculature of the pelvic floor consists of two different layers, deep and superficial. There are multiple dysfunctions of the pelvic floor muscles, especially in women, due to factors such as pregnancy, childbirth, inactivity, overweight, and aging. Dysfunctions of the pelvic floor and deep core muscles reduce functional capacity and the quality of everyday life. Dysfunctions include functional and structural disorders related to urination and defecation, as well as gynecological prolapses. During pregnancy and vaginal delivery, soft tissue structures are stretched. Perineal tears that may occur in different degrees during childbirth increase the risk of dysfunction. Urinary incontinence is the most common symptom of dysfunction, with the most common types being stress incontinence, mixed, and urge incontinence. 25 to 50% of women experience occasional urinary incontinence at some point of their life. Functional activation of the deep core muscles together with the pelvic floor muscles is important in the prevention of pain and dysfunction. Weak activation of these muscles is associated with back pain. Pelvic floor pain itself is usually felt deep in the rectum, in the area of the pelvic floor. Some of the pain may result from muscle spasms, for which initial treatment includes heat and relaxation exercises. Prolapses are changes that bulge into and out of the birth canal. They are also known as vaginal hernias. In these gynecological prolapses, the uterus, front or back wall of the vagina, bladder, or rectum can protrude, for example, through the vaginal opening. Factors influencing gynecological prolapses include weaknesses in the muscle tissue and connective tissue of the pelvic region, childbirth and mode of delivery, and aging. There are different types of prolapses and many levels of severity. Symptoms of prolapse may include a feeling of pressure in the pelvic floor and difficulties with urinating and defecating. Mild symptoms caused by a prolapse can be treated, for example, with pelvic floor muscle exercises. More severe symptoms are corrected surgically. In this first picture, you can see a weak pelvic floor. The line marking pelvic floor muscles is saggy, organs are not supported well, and lumbar curvature is increased. In the second picture, the line marking pelvic floor muscles is strong and healthy. Organs and spinal posture are well supported by that. Next, we will go through how to try pelvic floor contractions. Take a comfortable position and close your eyes if you want to. Think about where your rectum, vaginal opening, and urethra are located. Imagine a zipper that you zip up from the back to the front, starting from your rectum over the vaginal opening and urethra. When you contract, it should feel like you are pulling and lifting your vagina towards your belly button. When you get the idea of that, you can test the contraction strength of your pelvic floor muscles yourself with the finger test. First, wash your hands and put some lubricant, for example cooking oil, on the index and middle fingers of one hand. Gently insert both fingers into the vagina about 3 to 5 centimeters deep. Relax for a moment. Squeeze your fingers with your vagina and then let go and relax. Take the fingers out and wash your hands. When talking about training of the pelvic floor muscles, everyone can take action to improve and maintain the strength of their pelvic floor muscles. The pelvic floor muscles are partially voluntary muscles and can be improved through training. Training begins in positions where the muscles are easy to feel, for example lying on the side, sitting, or squatting. Furthermore, the goal is to achieve more functional starting positions, such as standing. In cases of dysfunction, the training should be long-term, 1 to 2 times a day, 5 times a week, and for several months. The first results are usually noticeable in 6 to 8 weeks. Being motivated and active is crucial. Pre-activation and training in connection with everyday activities. Making effort to prevent dysfunctions should be a lifelong venture, regardless of age. In this table, you can see basic strength exercises for the pelvic floor muscles. There are 4 different kinds of exercises for awareness, maximum strength, endurance strength, and speed strength. On the left side panel is noted the length of contraction, strength of contraction, rest between contractions, how many repetitions you should do, and training frequency. Training the pelvic floor muscles should be integrated into everyday activities and chores. It would be important to contract the pelvic floor, for example when lifting, climbing stairs, getting up from a bed or a chair. While the pelvic floor needs to be trained, relaxation must also be practiced. It is important to learn to differentiate between a relaxed and tense pelvic floor. When relaxing the pelvic floor muscles, it is beneficial to incorporate breathing as the pelvic floor is connected to the diaphragm. When we inhale, both the diaphragm and the pelvic floor lower, making it easier to relax the muscles. When we exhale, the pelvic floor muscles rise. Having an overly tense pelvic floor is a common problem, and tense muscles are not equivalent to strong muscles. It is important to know how to relax the pelvic floor muscles. The pelvic floor is a system by itself. Muscles need to be strengthened, but not excessively. Overly tense muscles can lead to problems such as pelvic, buttock, and lower back pain, urination and defecation problems like crippling, increased needs to urinate, constipation, pain during intercourse, and even teeth grinding. In these poses, you can see different ways where you can try relaxation of the pelvic floor muscles. There are some tools that can help you out with training of pelvic floor muscles. You can download, for example, mobile apps on your phone and use it to assist in training. In case of dysfunctions, there is evidence of the effectiveness of training with biofeedback devices. They also help in identifying the muscles. If you wish to utilize biofeedback devices, you can seek physiotherapy from the private sector. Diastasis recti, meaning separation of the abdominal muscles, is a natural occurrence during pregnancy. Its prevalence is 100% in the last trimester. The cause of the separation is not certain, nor is the scientific evidence on how to prevent it. Spontaneous recovery of the abdominal muscles is known to occur during the first year after childbirth, and the recovery is fastest during the first 2 months. Physical performance does not decline during pregnancy. It can even improve by up to 40% during the first trimester. Of course, the possibility of nausea and fatigue doesn't always make it feel that way. When pregnant, you should be able to talk during exercise. Regular exercise can be maintained up to the last trimester. Exercise during pregnancy is recommended, and being in good physical condition makes childbirth easier and possibly faster. Here you can see the RPE scale. During pregnancy, on the RPE scale, exercise should be performed on the exhaustion level between numbers 6 to 15. It is recommended to prefer interval type exercise that improves and maintains your endurance. Interval type exercise alternates between more intense and easier activities within one workout. In this picture is the physical activity recommendation for 18 to 64-year-olds that also applies during pregnancy. It introduces the amount and type of physical activity beneficial for the health of working-age adults. Next, we are going to list benefits of exercise during pregnancy, and those are: it strengthens respiratory and circulatory systems, enhances the circulation of fluids in the body, balances hormonal activity, helps to control weight and blood fat levels, alleviates nausea and constipation, prevents urinary incontinence, back pain and joint pain, makes childbirth easier and makes recovery from pregnancy and childbirth easier. During the first trimester, all forms of exercise are suitable, except for scuba diving. If you're used to exercising, continue as before. Just remember to listen to your body and rest when tired. Exercising outdoor can boost your mood and help with nausea. At this point, you should start to exercise your pelvic floor muscles. Engage in endurance-maintaining activities such as brisk walking, swimming, cycling, and aerobics. Prefer activities that help you maintain your posture and muscle strength, for example, Pilates, light gym, or weight training. Gradually, as the joints loosen, eliminate activities involving sudden motions and harder impact on the surface, like jumping and activities involving sudden changes in direction. During the second trimester, pay attention on training the muscles supporting the back and the deep abdominal muscles. As your pregnancy progresses, the superficial abdominal muscles move apart from each other, so it is best to avoid activating them too much. Working the superficial abdominal muscles causes the gap between them to increase. This slows down the postpartum recovery of the abdominal muscles. It is okay to get out of breath, but you must be able to talk while exercising. Prefer interval type exercise that improves and maintains your endurance. Such exercise promotes metabolism and alleviates swelling. In muscle strength training, pay attention to training the arms and the neck shoulder area. During exercise, prefer side lying and on all fours positions rather than laying on your back. Lying on your back is not recommended for long periods after the 16th week of pregnancy if you feel uncomfortable during that. The uterus may press the veins returning blood to the heart, causing discomfort and impairing blood circulation in the placenta. You can do one movement while lying on your back, then one on your side, and then on your back again. In the gym, use less weight and resistance and make sets longer. Focus on muscular endurance rather than strength training. For core muscles, you can get a good workout with a fitness ball. During the third trimester, exercise should be gentle, involving calm activities such as pregnancy Pilates or yoga, light stretching or water exercise if the cervix is closed. Walking and light gym or weight training is also allowed if it feels good. You should maintain basic fitness, just remember to ensure sufficient rest. For resting your back, you can lay down on your side with a pillow between your knees for support. At this point, it is also good to start with pelvic floor relaxation exercises. In general, it is important to maintain the fitness of the deep abdominal muscles, pelvic floor muscles, and the abdominal oblique muscles. The further along the pregnancy is, the more advisable it is to do exercise that increases the heart rate in intervals. And remember that you must be able to talk at all times. It has been claimed that if the heart rate is too high for more than 15 minutes continuously, the blood circulation of the placenta may weaken. It is okay to get out of breath and to increase your heart rate, but in moderation. Increasing your heart rate is less of a concern if you are a fit and active person who is used to exercising. Possible contraindications to exercising are bleeding, contractions that require treatment, rupture of membranes, placenta previa, preeclampsia, slowed fetal growth, twin pregnancy, and cervical insufficiency. If any of these occur, discuss exercise with the doctor. Other factors such as overweight, abdominal obesity, a chronic cough, poor posture, heavy standing work, and long-term constipation can increase the pressure on the pelvic floor muscles. Next, we will go through some exercises that you can do while pregnant. Lie down on your side, legs in front of you at approximately a 45-degree angle. During exhalation, gently tighten your lower abdomen inward. Hold the tension for about 10 seconds. Relax and repeat 10 times. You can do this exercise sitting or standing. Lie on your side with your back and pelvis in neutral position. Knees and hips are bent. Press lightly with your top hand against the surface. Keep your heels together. As you exhale, lift your top knee without letting your back or pelvis twist backward. As you inhale, return your leg to the starting position. Repeat at least 10 times. Do the same on the other side. Tight quadricep muscles can potentially alter the position of the pelvis and cause strain on the lower back. Lie on your side. Place your lower leg in front of you, bent at the knee. Grab your top leg at the ankle. Lightly squeeze your buttocks together and move your leg backward. Hold the stretch for 30 seconds. Repeat 2 times. Do the same on the other side. Sit on a chair with your back straight. Keep your hands crossed on your chest. Gently pull your lower abdomen inward. Bend from the hips, keeping your back straight, and perform a small quick rotational movements with your upper body. Repeat 30 to 40 times. This exercise can be done up to the end of the second trimester. Start in all your first position and gently tighten your lower abdomen inward. Alternate between raising your hand straight forward and to the side at a horizontal level. Hold for a moment, stretching the length of your hand. Keep your back in the same position. Repeat 10 times.